Hello and welcome. Today we're going to be talking about different supplements, how to use them, common fertility supplements, additional supplements that you could consider for specific reproductive concerns, and key considerations and precautions. You guys know, based on the whole last couple presentations, that my whole focus is really getting our nutrients from the food that we eat. It is really common right now for your general doctor or your OBGYN to suggest, or your midwife to suggest, that you take a supplement during your pregnancy and even if you're trying to conceive. So let's talk about that topic. If you guys aren't already doing so, YouTube, Instagram, TikTok, please follow me there for exclusive content. And please share this course with a friend or a loved one, even if they're just working on their gut health, or maybe in the future they want to have a child, and or maybe they're struggling with PCOS. Literally just share the course and let's empower women and help get the world pregnant, especially those ones that really want to be. And warning, this is the most important video in the entire course, so watch the entire video. Don't skip it. You can always watch this on 1.5 or 2 speeds. So, when and how to use supplements. There is an impact on your menstrual cycle, so proper nutrition is essential for your reproductive health. But even with a balanced diet, some people may have difficulty meeting their nutrient needs. Supplements can help fill in the gaps, but they must be used strategically to optimize your fertility outcomes. So here's how to identify and supplements that can support your reproductive health. So we first want to start by identifying nutrition deficiencies. So if you have a poor diet, a diet that is high in processed food or low nutrient dense whole foods. So say you're eating like white rice, there's not a ton of nutrients in there, or if you're eating cinnamon rolls, like there's not a lot of good quality nutrients in there that are helping heal your body. And they also lack vitamins and minerals that are essential for your reproductive health. Another area of concern with nutrition deficiencies is there an absorption issue. So this would be something like celiac disease, Crohn's disease, IBS, leaky gut, anything that's causing your body to not properly absorb all your nutrients. Additionally, some people have issues absorbing specific nutrients like B12 or iron, even if they're consuming adequate amounts. And medical considerations. So conditions like PCOS, hypothyroidism, and insulin resistance can actually increase the need for certain nutrients, as these disorders affect the metabolism and hormone balance. So regular testing can actually help you identify specific nutrient deficiencies that may not be obvious from the diet alone. Blood tests, nutrient panels, and hormone evaluations can detect deficiencies like vitamin B12 and D, as well as minerals like magnesium and iron. These tests can guide to a targeted supplementation to support your reproductive health. So in the interview with Jessica Raymond, you will see a guest expert interview. She goes through all of the lab testings that she suggests for certain different type of concerns. So if you guys haven't checked her out yet in the guest expert interview, you're going to want to learn from her, because this is her niche with testing, taking labs, and knowing what to look for when you do get your labs tested. So let's talk about the signs and symptoms of common deficiencies that can impact your reproductive health. So remember, the signs and symptoms that our body is giving us some insight into what's actually happening in the body. If there's something that's not working properly, you might see it as just migraines. We're not looking at migraines just as migraines anymore. We're looking at the deeper issue, right? Why are these reoccurring? Why do they keep coming back? So fatigue is a common sign and symptom. This is a common sign of a deficiency in iron, B12, and magnesium, all which are vital for your energy production and cellular function. Irregular periods. Deficiencies in essential nutrients like B6, magnesium, and omega-3 fatty acids can contribute to hormonal imbalances, resulting in irregular menstrual cycles or ovulation problems. and mood changes. So low levels of certain nutrients such as magnesium and B vitamins can contribute to mood swings, anxiety, depression, which can all further impact your reproductive health. Now, there's dietary limitations that may require supplementation. A vegetarian or vegan diet, individuals that follow these plant-based diets particularly are lacking in vitamin B12 because that's found only in animal products. And B12 is essential for DNA synthesis and red blood cell production, which are vital for reproductive health. Iron, so non-heme iron from plant-based sources is less bioavailable than heme iron from animal sources. Iron is important for energy levels, ovulation, and overall reproductive health. And omega-3 fatty acids. While omega-3s are found in plant sources like flaxseed and chia seeds, the conversion of a plant-based ALA to an EPA and DHA, the active form of omega-3, is inefficient. So this may necessitate supplementation with algae-based omega-3 supplements. Food intolerances and nutrient absorption issues based on the other issues or complications that we listed before. People with food intolerances such as lactose intolerant or gluten sensitivity may struggle to absorb the vital nutrients. So lactose intolerance, those who avoid dairy can cut out a significant place for getting calcium and vitamin D, which both are essential for bone health and reproductive hormone production. And gluten sensitivity or celiac disease, malabsorption of key nutrients like iron, folate, zinc is common with gluten-related disorders, potentially leading to reproductive challenges. And age-related changes in nutrients needs for fertility. So as people age, requirements change, particularly when you're trying to conceive. So folate is crucial for women in the childbearing age. Folate supports DNA synthesis and reduces the risk of birth defects. As women age, they need higher folate intake to support healthy cell division. And CoQ10, this is known for its role in energy production. CoQ10 is naturally declines with age. So supplementation has been shown to actually improve your egg quality and your sperm motility, making it particularly beneficial for those who are trying to conceive later in life. And we want to make sure that we are prioritizing the high quality supplementation. So not all supplements are created equal. When you're choosing your supplements, look for high quality options that are free from fillers, artificial additives, and unnecessary binders. Some of the key factors to look for is the bioavailability. So choose supplements in forms that are more easily absorbed by the body. Example is like a methylated B12 or a chelated magnesium. And check for third-party testing. So look for brands that undergo third-party testing to ensure the purity and the potency. And avoid fillers. So choose products with minimal fillers or synthetic additives, and these can interfere with the absorption and have adverse reactions. So we're going to talk about integrating these supplements into your daily routine. So timing it with meals. Some supplements are better when you're putting the food groups together. So some supplementation is fat soluble. So you want to combine that supplement with a fat. So fat soluble vitamins like D and omega-3 and others like iron is better absorbed on an empty stomach. So make sure you're aware of what you're taking it and how to time it with your meals. Next is your dividing dosages. So for nutrients that require higher doses like magnesium and vitamin C, consider taking it throughout the day to improve your absorption rate and reduce gastrointestinal discomfort. So instead of taking 6 magnesiums all at once, you can space it out 2-3 times a day. And consistency. Supplements often take time to work, so consistency is key. Set reminders and pair it with an activity that you're already doing. So Take them with breakfast time, or maybe something that you eat on an empty stomach, you take it before you have your breakfast, before you then brush your teeth, go exercise, and then you eat your breakfast. So you want to have it stack so you make sure that you can keep doing it. And when to start? The general recommendations is 3 to 6 months before trying to conceive. So as you continue to work on your overall health, eliminating toxic food from your life, eliminating stress, give yourself that 3 to 6 months to actually prepare your body from the inside out. And that's the same for supplementation. So for individuals that are trying to conceive, it's recommended to start 3 to 6 months prior. This allows the body to build up sufficient nutrient stores to support healthy ovulation, sperm production, and overall reproductive function. For example, folic acid is recommended for all women in the childbearing age to reduce the risk of neural tube defects in early stages of pregnancy. Folate, we know, is the nutrient that folic acid has been synthetically made from. So if you're having enough food with folate in it, then you wouldn't need to supplement this. So this might be a good reason to really test before you just start adding in a bunch of supplements. So we're thinking long-term strategies versus short-term for interventions for specific fertility goals. So nutrients like folate, vitamin D, antioxidants, omega-3s are best taken consistently over time to optimize reproductive health. These nutrients support long-term reproductive function and improve the egg and sperm quality, and helps regulating hormones and reducing inflammation. And they're short-term interventions. So some supplements like CoQ10 or Incital for women with PCOS may be used to target interventions and to address specific fertility challenges. These supplements can be added as needed based on individuals' health conditions or goals, but it should still be monitored for effectiveness. And now let's talk about common fertility supplements. So folic acid or folate, like I just mentioned, it helps in the cell division and supports the fetal neural development. It reduces the neural tube defects, and there's important for both men and women in supporting DNA synthesis and sperm health. So the recommended dosage for women of reproductive age is 400 to 600 mcg per day, and that may change during your pregnancy. Vitamin D, the role is regulating reproductive hormones and improving fertility outcomes. Vitamin D deficiency linked to ovulatory disorders and lower sperm quality. The supplementation is 1,000 to 2,000 IUs per day, but higher doses up to 4,000 may be needed. And sun exposure. We know that being in the sun is the best source for vitamin D. So 15 to 20 minutes of sun exposure, even if the sun's not out, just get outside, is sufficient to meet their D requirements, but depending on your location and your skin type. Blood levels should be ideally between 30 and 50. And omega-3 fatty acids, the anti-inflammatory properties that support hormonal balance and improve egg quality. The importance for fetal brain development during pregnancy, and it's found in fatty fish or fish oil or plant-based supplements like algae oil. And DHA, EPA, you want to aim for 300 to 1,000 mg per day combined, EPA and DHA. So the sources found in fish like salmon 2 to 3 times a week, or with supplements like fish oil or algae oil for plant-based option. And CoQ10, the role is in improving the mitochondrial function and energy production in cells. The evidence for CoQ10 in improving egg and sperm quality, particularly in older individuals. And the dosage guidelines for fertility support. 100 to 300 milligrams per day. Some fertility specialists recommend high doses as much as 600 mg per day, and for women over 35 undergoing fertility treatments. And zinc. Zinc is crucial for sperm production, motility, and hormone regulation. Zinc deficiency is linked to low testosterone levels and poor sperm quality in men. So the importance for zinc in egg development and ovulation in women. For men, they need 11 mg per day, and for women, they need 8 mg per day. Zinc can be found in the dietary sources like meat, shellfish, legumes, and fortified cereals. Supplementation may be needed if dietary intake is insufficient. So looking back at those diets that aren't including animal sources of protein, then you may have to supplement to get the adequate amount of zinc. So in review, iron. Iron is essential for healthy blood circulation and preventing anemia, which can affect ovulation. The benefits for improving energy levels and supporting your reproductive function. In postmenopausal women, 18 mg per day. In pregnant women, 27 mg per day. Heme iron from animal sources is better absorbed than non-heme from plants. Supplements are often necessary for if iron levels are low, particularly for women with heavy menstrual cycles or during pregnancy. And then we have B vitamins, focusing on vitamin B6 and B12. B6 supports hormone regulation, reduces PMS symptoms, and improves your luteal phase health. B6 recommended dosage is 10 to 50 mg per day, and for higher doses sometimes is used in fertility support. And B12 is essential for maintaining egg and sperm health, so DNA synthesis and energy metabolism. B12 recommended dosage is 2.4 mcg per day, though supplementation up to 500 to 1,000 may be necessary when absorption issues or vegan-vegetarian diets are at play. Probiotics. The role of probiotics is to support the gut health, which is linked to the hormonal balance and nutrient absorption. There's a connection between probiotics and improved fertility outcomes, especially in PCOS. The best probiotic strands for reproductive health is lactobacillus. And when you choose your probiotic supplement, you want to aim for 1 to 10 billion CFUs per day. So the best strains is the lactobacillus and bifidobacterium, and you want to look for something that has at least 2 to 10 different strains. You don't want all the same. Magnesium. So magnesium helps regulate the stress hormones like cortisol and supports sleep, which is both crucial for fertility. The role in muscle function, including the reproductive organs, and magnesium-rich foods versus supplementation like magnesium citrate or glycinate. For women, 310 to 320 is needed, and for men, 400 to 420 is needed. Supplement forms like magnesium citrate or magnesium glycinate are well absorbed. Selenium, a powerful antioxidant that protects sperm and eggs from oxidative stress. The role in improving sperm motility and supporting thyroid health, which impacts your reproductive hormones. 55 mcg a day is recommended, and the sources, you're going to find it in Brazil nuts, and you really only need 1 to 2 per day to get the recommended amount. You can also get selenium from eggs and seafood. There are additional supplements for specific reproductive concerns that we're going to talk about. Inositol. I don't know why I can't say this word. It just is what it is. Benefits for women with PCOS. So inositol is naturally occurring, and it's a sugar alcohol that plays a key role in cell signaling, including the pathways related to insulin and reproductive hormones. Women with PCOS often experience insulin resistance, which can disrupt ovulation and hormone balance. This inositol, particularly in the forms of myo-inositol and D-chiro-inositol, have been shown to improve insulin sensitivity in women with PCOS, leading to more regular ovulation and improved menstrual cycles. By reducing insulin resistance, inositol has also lowered androgen levels, which are often elevated in women with PCOS and contribute to other symptoms like irregular periods and infertility. There is evidence for inositol in improving egg quality and fertility outcomes. In addition to improving insulin sensitivity, it has been linked with better egg quality and increased fertility in women with PCOS. Research shows that inositol supplementation can enhance the oocyte maturation, and improve the response to ovarian stimulation in women undergoing fertility treatment such as IVF. These effects make Inositol a valuable supplement for women struggling with fertility due to PCOS. And the recommendation is 2 to 4 grams of myo-inositol daily, often combined with D-chiro-inositol, a ratio of 40:1 for optimal results. NAC, N-acetylcholine. We're going to just never mind that I'm butchering all these names. It's an antioxidant property and the role in reducing inflammation. So NAC is a powerful antioxidant that helps replenish the levels of glutathione, which is one of the body's most potent antioxidants. It reduces oxidative stress and inflammation, both which can impair fertility and contribute to conditions like PCOS. So by neutralizing the harmful free radicals, NAC provides reproductive cells from damage and promotes a healthier environment for conception. It also improves egg quality and fertility in women with PCOS. So it has been shown that it can actually improve ovulation rates and enhance the effectiveness of fertility medications. And for women undergoing fertility treatments, NAC may be improved outcomes by promoting better egg maturation and reducing inflammation in the reproductive organs. The dosage, 600 to 1,200 mg per day, and higher doses may be used under medical supervision, especially for women with PCOS or undergoing fertility treatments. L-arginine. This helps improve blood flow to the reproductive organs and enhances sperm quality. So L-arginine is an amino acid that helps increase the production of nitric oxide, and this is a compound that releases blood vessels and improves circulation. Better blood flow to the reproductive organs can support the sperm production and improve sperm motility and morphology. For men, the increased blood flow to the testes enhances sperm quality and overall reproductive health. The role in supporting egg health and the endometrial lining, and women, the improved blood flow to the ovaries and the uterus can promote egg health and enhance the thickness of the endometrial lining. A thicker, well-nourished endometrial lining is essential for successful implantation of a fertilized egg. L-arginine is also thought to improve the quality of cervical mucus, which plays an important role in the conception by facilitating the sperm transport through the reproductive tract. The dosage ranges from 2 to 6 grams per day. L-arginine is taken alongside of other supplementations or fertility treatments to boost the overall reproductive health. Ashwagandha. The adaptogen that actually helps regulate stress. Ashwagandha is well-known adaptogen. It means that it helps the body adapt to stress and restore balance. So chronic stress is a major factor that negatively affects the reproductive health by increasing the levels of cortisol, and cortisol interferes with reproductive hormone production. Elevated cortisol can disrupt ovulation in women and reduce testosterone production in men, which both would impair with fertility. Ashwagandha helps to regulate the body's stress response by lowering cortisol levels and promoting a more balanced hormonal environment for conception. The benefits for balancing your hormones and improving your fertility outcomes. Ashwagandha has been shown to have a positive impact on women for hormone balance and on men. In women, it also can support regular menstrual cycles by reducing stress-related hormone disruptions and can improve ovulation. In men, it's known to improve sperm quality, including the motility, concentration, and volume. Studies have shown that it can also increase testosterone levels, which are crucial for sperm production and the overall reproductive health. So the recommended amount is 300 to 600 mg per day. It's a standard extract. It can be taken in a capsule or a powder, and it's also used as a broader regimen to manage your stress and promote hormonal health. Ashwagandha is one of those that I oftentimes use to help people who feel chronically stressed or have anxiety, as it does help reduce stress in the body. Some key considerations and precautions to take. So you just don't want to take excessive amounts of certain nutrients. So supplementation can be helpful, but if you take too much, it can lead to toxicity and health complications. Fat-soluble vitamins such as A, D, E, and K are stored in the body and can build up to toxic levels if it's consumed in excess. Vitamin A is excessive amounts can lead to birth defects if it's taken during pregnancy, as well as liver toxicity. So pregnant women who are trying to conceive should avoid taking high doses of preformed vitamin A supplements. And vitamin D oversupplementation can cause calcium buildup in the blood, leading to issues like kidney stones or heart problems. So it's important to monitor your vitamin D levels with testing to ensure safe dosage. And minerals. So iron and zinc also carry risk when that's taken in excess. So too much iron can lead to gastrointestinal distress, liver damage, or an overload, while excessive zinc can interfere with copper absorption and lead to immune system dysfunction. So the key to avoiding these risks is testing and monitoring your nutrient levels. Blood tests can help determine which supplement is necessary for you and at what dosage you need to meet your body's needs without exceeding. So consider doing regular blood tests and nutrient panels to determine your baseline levels of key nutrients. Healthcare providers can assess whether the supplementation is needed to monitor your changes over time. So vitamin D testing can help maintain blood levels in the optimal range, reducing the risk of deficiency or toxicity. For iron, serum ferritin tests can actually indicate whether iron supplementation is needed, especially for women with heavy periods or anemia. And monitoring ensures that supplementations are working efficiently and help adjust dosage as needed, particularly during pregnancy or fertility treatments where the nutrient demands change. And now let's talk about timing and the combination of supplements. So how can certain supplements work better when they're taken together? Some supplements are more effective when they're taken in combination due to their synergistic effects. So certain nutrients enhances the absorption and utilizations of others, improving the overall efficiency. One example is vitamin D and calcium. So vitamin D plays a crucial role in calcium absorption. So without adequate vitamin D, calcium cannot be absorbed properly, leading to deficiencies. So if calcium intake is high, but vitamin D levels are low, supplementing with both can ensure bone health and support your reproductive functions. Zinc and magnesium. Zinc and magnesium are both essential minerals for reproductive health, and they work well together in supporting hormone production and regulation. However, they should be taken at different times of the day to avoid absorption interference. Vitamin C and iron. So vitamin C actually enhances the absorption of non-heme iron found in plant sources, making it ideal pairing for individuals supplementing with iron to prevent or treat anemia. Taking an iron supplement with a glass of orange juice or alongside of a vitamin C tablet actually improves the absorption. And let's talk about the best times of the day. So timing can play a significant role in maximizing the benefits, particularly when you're balancing your energy, stress level, and sleep. So supplements in the morning, it's going to require higher absorption, such as vitamin B or iron. It's best taken in the morning. Iron is best absorbed on an empty stomach, and B vitamins help support the metabolism and energy production throughout the day. In the evening, supplements like magnesium or ashwagandha, they promote relaxation and help reduce stress, and are more effectively taken in the evening. Magnesium helps improve your sleep quality and regulate your cortisol levels, which can support your hormonal balance. And fertility-specific supplements like CoQ10 and omega-3s can be taken in the morning or with meals to ensure optimal absorption. In addition, taking supplements with fat-soluble nutrients such as vitamin D or omega-3 alongside of meals that contain healthy fats is going to improve your bioavailability. And you guys now know what these healthy fats are. That's on your approved list that you can eat all that you want. Your avocados, your coconut oil, your olive oils, your your oils and fats from nuts. All those are great options. So let's just remind you, and just everybody, as this is like created, that no two individuals are the same. And supplementation needs to vary based on your factors like your age, your health conditions, and like where your current needs are and your fertility goals. So a health care provider or a specialist can help you evaluate your specific needs and design a program that makes sense for you. A woman with PCOS may benefit from Insutil to regulate their insulin levels, while a man with low testosterone might need to take zinc and ashwagandha to support the hormone production and sperm quality. Pregnant women or those going through fertility treatments should consult with their healthcare provider to ensure that supplements are safe and beneficial for their stage of reproductive health. All right, so certain supplements can actually interfere with medications and exacerbate existing health conditions. So it's essential to disclose any medications or treatments that your healthcare provider before you just start taking supplements. Blood thinners and vitamin K. Vitamin K plays a role in blood clotting, and taking high doses can interfere with the blood thinners like warfarin. So if you are on blood thinners, your healthcare provider can help you monitor vitamin K intake. Thyroid medications and calcium. So iron and calcium supplements can actually interfere with the absorption of thyroid medications. It's important to space out these supplements and medications at least by 4 hours to avoid this interference. And chronic conditions like diabetes, autoimmune diseases, or heart disease may influence supplement choices. For example, individuals with diabetes should monitor their blood sugar levels when certain supplements like Insutil may affect their insulin sensitivity. So what's next? We are nearing the end. I would love for you to reach out. There are different programs. If you don't want to go right to your doctor, you want to be able to draw your labs. I know there's different like labs where you can go in and just get a full panel of your blood if you don't want to wait months to get into your healthcare provider. Once you have this information about what's your body missing, you can adjust with your diet first. And if you're still not able to get all the nutrients in that you need, then consider supplementation. I'm curious to hear, are there certain supplements you started taking and why? Drop a comment in the group chat. Feel free to ask questions around supplementation. And if you guys aren't already doing this, follow me on YouTube, Roots in Fertility, and I will see you guys for our final video in this course, which is going to do a review and a recap quiz, and then I will see you in the next session, which will be our deep soul work, which is like looking at our food story, our programming, our relationship with food, our traumas, our unmet emotional needs, pulling into more of the psychology rather than just the physiology. So I'm really excited about this next course coming up. Thanks for following me along this far, and I'll see you guys in the next video.